Hi everyone, we're still in primary assessment and we've come to our last segment in our primary assessment. So far we've covered airway, breathing, circulation, disability, and now we get to letter E, which stands for exposure.
And you don't want us exposing ourselves.
Actually, Dr. Venkman, we do want to expose our patients because if we can't see it, we can't identify it, we can't treat it. Now, when we're talking about exposure, to be clear, we're talking about removing articles of clothing from this child so that we can directly visualize the body for the purpose of examination. Having said that, what's not in the text we need to think about is our social climate. Everybody out there with a smartphone has a camera or a video in it. It is our obligation, our responsibility, our duty to protect our patients' privacy and their dignity. Therefore, patient condition permitting, time permitting, expose your patient in private, in the back of the ambulance, in the ER with the curtain closed. Now, what are we going to expose on this patient? If it's a focused examination, we're focusing on the area of complaint. Whatever the patient's complaining about, that's the area we're going to expose. For example, child trips, rolls their ankle. I only need to expose the ankle. I don't need to take their shirt off and assess for heart tones necessarily. I'm going to focus on that ankle. Take the shoe off, take the pants up, and examine and expose that area of the body that they're complaining about. Focused. If they're having trouble breathing, of course I'm going to expose the chest. Now when we do that, what are we looking for? When we're exposing them, what are we looking for? Well, we're looking first for the things we would expect to see. If it were a trauma patient, I'm looking for bruises, lacerations, and because this is a primary assessment, I'm looking for life threats. That's really what I'm looking for life threats. So we're looking for the things that we might expect to see based on the patient's complaint and history. We're also looking for things that we don't expect to see, or hopefully we don't see, like signs of abuse. The child should not have marks on their back, burns on their back, bruises on their back in varying degrees of healing. These are all signs of child abuse. And when you're exposing a child, it's a great opportunity to assess for abuse. Now, when we're talking about exposing a patient, if we're doing a focused exam, we're only exposing that area of the body that we're focusing on based on the patient's complaints. When would you expose the entire body? Well, let's say an unresponsive trauma patient. Well, all the clothes have to come off so we can do a complete head-to-toe assessment of this child. Now, the literature states to keep them covered, keep them warm. This is very important. You do not want that child or your patient developing hypothermia. If they develop hypothermia, remember their enzymes can stop working, which means drugs aren't going to work very well on them. Also, their coagulation properties begin to fail. Cold patients can't clot. So in trauma, we have got to keep them warm. So if you're exposing that patient, expose a part, cover it up. Expose another part, cover it up. Keep that patient warm. Let me give you another dramatic example of the importance of exposing your patient. Now look at this guy here. This is a dramatic example of paradoxical chest movement secondary to a flail segment from trauma. Now if I were to take this guy, put him in his shirt, a winter jacket, prop him up in a car, and I show up at the scene, all I'm going to see is a guy breathing fast. Unless I expose and look at that chest, I'm going to miss this injury. You have got to expose the chest. Now if you're a brand new responder, you open up the shirt, you see this, you're going to go, oh my God, and the patient's going to go, what? And you're going to go, nothing. And the patient's going to go, that didn't sound like nothing. This has been a review of exposure, the final component of the primary assessment. Now, we've had a bunch of videos on the primary assessment. The literature says this should happen rapidly. How long should it take to do a primary assessment? Honestly, about 60 seconds. It's done pretty quick, and again, we're looking for life threats. Now, if you're a responding unit, you have other people with you. During your assessment, if you find a life threat, you assign someone to tackle that problem and you continue on with your assessment. If you're alone and you come across a life threat, that's when you stop, you address that, and you don't move forward until that life threat's been fixed. However, if you're responding with a whole unit, assign someone to fix it, continue on with your primary assessment. I'm Mark, thanks for watching these videos on primary assessment. Secondary assessment's coming up next.